Okay.
Good evening, everyone. We would like to wholeheartedly welcome each one of you for the ongoing Mental Health Webinar Series 2020-2026. This is on behalf of the organizers, the Department of Psychology, American College of Madurai, in association with Yellowpond Counseling and Wellness Center, and the Tamil Nadu Counselors and Psychotherapists Association. Our honorable and esteemed resource person for the day is Dr. Sripriya Shawji Ma'am. She's a counseling psychologist and a nutritionist at Srisha Counseling, Koikot. Today, her topic focuses on Beyond the Therapy Room, redefining the role of psychologists in modern healthcare. I call upon ma'am to start today's session.
So you want me to start directly right away?
Yes, ma'am.
Okay, because Meenakshi ma'am was saying like she wanted to wait for more participants. Yeah, very good evening. How many of you are a psychologist, young psychologist here? Like students? Can I get to see that in our chat box? Okay, very good. Hands raised. Thank you, thank you. So, what are your understanding about psychology? For some time, we'll have some small discussions and you can reply in the chat box. What is your understanding to be a psychologist? Where are the areas you can work in? After your course, maybe students can tell me after your course, what are your plans to work as a psychologist? Job opportunities. Anybody can type in your answers. Is there no one to type? Good evening. I plan to be a child psychologist. Very good, Viveka. Any other opportunities? Anybody else? Anybody else, seniors working as a different field apart from organization and behavior psychology or forensic psychology? Anybody else working in the hospital sectors or other areas of health psychology? You can just raise your hands. Okay.
Yeah, PVR.
Yes, sir has raised the hands. Sir. So what are you, sir?
PVR. Ragnesh.
Good evening. Yeah,
Yeah.
good evening. I'm into relationship counseling and mental health actually.
Relationship counseling and mental health. Very good. So anybody else? Okay. Nice to know about your ventures. I could see Mr. PVR and other people working into different parts of health psychology. So today, what I have given a last minute session yesterday. So what I thought is this conversation is very important for the psychologist to understand. Many people I come across always says that if I set up a clinic, I may not get patient or online consultation or something very restricted family counseling or very restricted what other areas we can do. And many go for the organizational and behavioral psychology to the corporates and other things. But there is one important field which is really in need and demand for psychologists is healthcare spectrum. And many times I see my colleagues who come to healthcare also get struck with some of the basics of healthcare knowledge. So today we are just going to explore on what is required, why it is important, why it is required. So what happens in the healthcare? Every day, many people are given prescriptions. Like, do you, any of you have any knowledge about how much of healthcare is in need today? Healthcare is kind of in a very high need in southern parts of India. Obesity is growing. Non-communicable diseases. Once long time ago, maybe even in my grandparents' generation, like he became a grandfather in 40, 45, and he died in 50. Why? because of some communicable diseases, jaundice, malaria, and kind of communicable diseases, they die soon also. But today, the average death age is around 70. And are they living peacefully and comfortably with this? No. Now there are India has eradicated many of the communicable diseases, but non-communicable diseases are increasing so massively. As we are developing, our non-communicable diseases also are developing. And every day doctors are seeing more than 50, 60 people per doctor in a tertiary center with diabetes, hypertension, fatty liver is growing like anything, obesity, anything you name it in non-communicable, we have it in India. And we as a country also have a lot of metabolic disorders. It is in our genetic traits also. So what happens with this prescription? Is the change easy? Let's see one Mr. Ravi. So this one man has got diabetes. This man may be in your clinic, in your house, your father, your grandfather, your uncle, or your neighbor, anybody. So when he was diagnosed with type 1 diabetes, the sugar goes uncontrolled. His doctor explained everything to him, what to eat, how much to walk, why it is must to quit smoking, or how long he can do certain things, why he shouldn't do. And apart from doctor, there is a dietitian, there is a diabetes educator, there is a lab technician, there is a pharmacist. Apart from these people in the healthcare, we have something today called Google. Google says everything. Why you shouldn't do this for the diabetes, do this for hypertension, do this for whatever it is, you can name it, it will be given. So information is abundant, but his diabetes is getting controlled. Unfortunately, many couldn't come into the control. Why? Many times, even as a dietitian, I have seen people saying, no, ma'am, I couldn't follow that. Why? Because are they lacking knowledge? No. It is not about the intelligence or the medicine not working. No, the pharmacotherapy has advanced so tremendously. What is lacking? Behavioral support is one important thing which is lacking in today's human nature. So, what is the healthcare change? As I said earlier, the healthcare has fundamentally changed. Today's healthcare doctors are more into non-communicable disease rather than communicable disease. They have to manage chronic diseases, prevention and early intervention, behavior as the core clinical target, and self-management, self-care. July is a self-care month. People know it is a Mr. Joe and Jyoti ma'am, can you please switch off, mute yourself? I humbly request all participants to mute yourself so that we cannot get distracted. So self-care and health empowerment is something we have to talk about more and more in today's world, because everybody knows everything. We all know everything, but we couldn't follow what is required. So this is where the psychologist or behavioral therapist is coming or taking the important role. So, what is the real causes of modern diseases? It's not just biology. If you think it is only because of biology, we are absolutely wrong. Today, we call it obesogenic environment, like atmosphere. So, the biology, or you're being an Indian, you get this vegetarian, your diet and all those things takes a part. The very important thing is the lifestyle choices we make. We always have a choice of carrying a dabba earlier. No option of not carrying a dabba earlier. So then there were ayahs who used to carry a big kuda and take to my father and all. I very well remember there is a kuda karama comes, pick his carriage, goes and deliver it as in his office and get back. But so he can easily, happily leave home by 6 and his lunch will be delivered by 11:30 at his office. But today, we like start from home by around 8, 8:30. And we have all the commutation mode. It is not just train or bus. Today we have even our own cars, but still we say, nah, get the software. I will eat from there. Okay. The choice you are making in the food. Okay. You can walk. You have time to walk. But let me take a lift for this 1 minute, one time. And every time there is no need for joining a party. There is no need for taking an alcohol. There is no need for taking a cigarette. But the choice and the social environment is shaping the biology and changing our genetics and making us more prone to non-communicable diseases. This behavior drivers are part and parcel of all these non-communicable diseases like diabetes, hypertension, BP, obesity, heart diseases, cancer risk. Many of the cancer risk, sleep, not all cancer, but many of the cancers are having the lifestyle choices or important sleep disorders. Today, another important thing, we are also not sleeping on time. We will say, okay, I can wake up tomorrow morning 7:30 and just directly go to office and eat breakfast from there. The choice is there, isn't it? Earlier days, your mother has to, like, once she has to go early, leave home, or your father or yourself has to leave home early. What we used to do, "Oh, tomorrow I have to wake up and go by 5, 7:30. So I have to finish cooking before that. I have to pack before that. So we have to wake up early, so we will sleep early. Today it is not the case. Today, anywhere, anytime, even if you go to the aerodrome, you can make your Swiggy order and you can eat of your choice from there. So these are all the drivers for many non-communicable diseases today. So who studies the behavior? Except none other than psychologists. As we study the behavior, that is precisely why we need to be in the healthcare team and what we are going to do. Why are we? Despite overwhelming evidence of role of behavior, honestly speaking, if there is around 61 doctor for 60 patient in India, there is not even one psychologist per 1,000 patients. That is what is the current scenario. We have a very less psychologist, and many times I find my colleagues or friends who says, "What will I do in office or hospital? What will I do in ICU? What will I do in the OPD?" So there are many things apart from the day-to-day basis counseling or marital counseling or organization counseling. We need to, like, apart from depression and anxiety or emotional crisis, we need to do some important areas. Real medicine is behavior and decision making, motivation and habit formation, relationship and communication, and adaptation and resilience. These are the basic psychological science. That's why from arts, psychology has turned to science. Earlier, they used to call BA psychology, MA psychology, but in the evolution process, they understood no more we belong to art category and we belong to the science category because behavior is the science. The science is behavior and decision making, motivation and habit formation, relationship and communication, and human adaptation and resilience. So remember, these four are the important core concept of science, psychology as a science, psychological science. So beyond the therapy room, what am I going to do in a non-communicable disease OPD, in a doctor's clinic or in a hospital? So psychologist are the only person who is equipped with the very important thing, that understanding human behavior. Many times you must have come across a doctor asking, why didn't you do this? Why didn't you take this tablet? Or your mother or father saying, doctor has written me 3 tablets per day. I have taken only 2. I forgot. No, these kind of behaviors are well studied, well understood by a psychologist. So what are the areas we will first understand? In diabetes and metabolic clinic, as a psychologist, we are going to do behavior change of glycemic control, that is sugar control, dietary adherence. Ma'am, is this recording?
I am doing.
Okay. So lifestyle modification. And in pediatrics and fertility area, infertility is another important thing which needs lots of psychologist support in family-centered care, in parenting support, and preparation to childbirth, and even child development. Someone said, I will become a child psychologist. The child development is not just restricted to the physical body, it is also needing a long process of psychological support. So these things are very important. Next area is obesity and lifestyle medicine. Obesity, many of us think today is because of eating, improper eating or laziness. I'm sorry, that is many reasons, hormones too. Even researchers today saying that adverse childhood emotions also carry forward this obesity, eating disorders. These are all parts and parcel of your life. So in lifestyle medicine, like emotional eating, motivational interviewing, sustainable lifestyle redesigning, all this comes with the psychologist. And rehabilitation, cardiac psychology is another interesting area for stress management or post-event recovery support and many things. And another very important primary area, which is again my core area, neurology and pain clinics, mainly for cognitive rehabilitation. Yeah, even you can come across anybody who has underwent a small fracture or post-fracture rehabilitation. Pain psychology, there's post-cancer treatment. There are many pain psychology, pain treatments, not only post-cancer, even in many conditions we have pain. And coping strategy developments, again oncology, post-oncology treatments, support, family support, grief counseling, all these things is the areas where psychologists can make their mark. So why they can make the mark and why is it important? Is it just money making? No, it is the very important for the overall quality of improvement of quality of life. So what is the invisible burden? All of a sudden, if a person, just say if they get a hypertension, what happens immediately? Anybody can open your chat and answer.
If they have the hypertension, the symptom is they are restless. If it is low means they couldn't even balance, as well as if it is in the higher form means they used to have some kind of symptoms like what to say, they couldn't even balance the thing to be in the straight posture. So that is a real symptom of hypertension.
I'm not asking about symptom. How do you feel when somebody is diagnosed with the disease? As a caretaker, you can just think if someone in your parents or someone is diagnosed with
Ma'am,
the yes, ma'am.
the agitation in your behavior, irritation in your behavior, and if this continues for a prolonged period of time, it may lead to a stroke or a even heart-related issues.
Please don't give me any medical condition. I'm talking about our psychological roles. Please tell me what happens psychologically if you or your relatives getting to know that they are having conditions like something.
Yeah.
Yes, Mr.
I
P.
used
So, ma'am, anxiety would be there that what if something happens to me? What if my BP shoots up so much that I have a stroke? The caretakers would also be at that edge that
Okay.
this can happen. It can, there can be a fall it can happen in the bathroom. So there can be a fall, so there is a constant, you are at the edge that you are feeling edgy that there's something might happen. So apprehensive behavior, which leads to anxiety and stress, of course.
as far as a psychologist concerned, the happened is happened. What is going to be the next step to treat for the betterment and to give the quality of life? That I have seen and practiced with my brother. I lost my brother 2 months ago. So before 1 year, we diagnosed with the ordinary cyst, but has been failed to remove the tumor from the cyst. So what is
Yes,
going to be
one thing
next? What kind of a treatment we can give to them? What kind of the food we can make to have the comfortable life? That is the thing I made. So
Okay.
Pragnesh, come forward.
Yeah, ma'am.
Yes.
First and foremost thing, the person who is suffering from any kind of a disease or something, which struck immediately, like suddenly. So first and foremost thing, they need the emotional support. The second thing, they are looking for the validations that okay, they are not all alone in this fight. Like they are there are few people, or there are their own people with them to fight with the situation, and it will be taken care of the way doctor will guide. We need to follow the instructions. I think that would be the first thing, that they need to accept it, that yes, it has happened.
Exactly, the emotional support. First question, if you are diagnosed with any small things, many times even we see young girls diagnosed with PCOD. First question the parents ask, why does my child have? Why me? Why us? Acceptance of the problem, isn't it? So many a times that is the emotional need. Why it happens to me? Will this end my life? Is it going to be life threatening? And second problem too, if it is in a middle age or elderly, fear of leaving your loved ones, no? And many times it is like in our society, having a disease is always an identity shift. Oh, he has that. Many times we feel, even in my own family, I have some of the people saying that I didn't committed any sin. So not those who are deceased are not sinners. That is one thing we have to understand. It is not about the sin we have committed. It is all about your body type and understanding and accepting to the diseases. And next important thing is the family strain. Most of the times it strains the relationships because of the disease conditions, the food changes, the pattern changes. There are many small things which changes, and that may strain the relationship and bondage of the family members also, and that may even cause a stress among the family and the person. And very important thing, the medical cost, the bill, daily medication may cost up to 150 rupees per day. So in overall a month, you have to pay for a 7,000 school fee as well as 7,000 medical bill. So that again causes the economical strain in the family. And cultural beliefs like fastings, pujas, and so many things are changed with the certain food habits or disease related protocol. And even today in 2026, the world is technologically advanced. We come to see many people are like, I'm 40, I don't want to, like, why are you adding sugar to your tea? I went to my friend's house, being 40, how can I tell I have diabetes? This kind of shame related and unspoken traumas many times, and the hope is the very important thing. Many times with the BP, as someone said, stroke, Shabnam, I think she said, anxiety of getting more problems next day. These things will relate. As Meenakshi ma'am said, the difficulty of passing day by day, uncertainty. These uncertainties, what might happen tomorrow. Even though the medical management is very much advanced, human mind still fears and flickers in the matter of hope. Okay, what very commonly healthcare often treats the diagnosis on the chart. They see you. Honestly, we have to appreciate Indian doctors here. Our doctors spend 20-30 minutes talk to you, make you understand, do many things, and drive the things. Whereas it is not possible in other parts of the world. But even then, they cannot completely take up a 1 hour for one patient because already they are running out of time. So what happens? Unavoidably, they are treating only the malfunctioning organs, not the person who is losing himself here. So, what way the psychologist can enter the care building? So the whole story, the barriers, why they could not do this, what are the wrong beliefs in the treatment, or even one patient, like she's a daughter of a doctor. She herself is a daughter of doctor, and she's herself is an engineer. But she said, Shripriya, I was identified like diabetes some 6 months ago. But my husband said, don't take medicine. That's why your mother died with low sugar, so you don't take medicines, and also I'm just trying to control it with the diet and exercise. I told, not everyone who takes medicines will die of low sugar. There are many reasons behind it. So we have to understand what is their barrier and belief, so this capacity change can be brought in only by the psychologist. So other than this, like beyond the compliances, it's not every time your patient will not do anything. Most of the times the patients will be very much perfect. They'll follow the diet, they'll follow the exercise, still things are not under control. And that doesn't mean the treatment fails again. It is because the change information is not properly done. So many times they were given a tablet which might be costly. They'll go to medical shop. They'll go for the generic tablet, or which is not available in the medical shop, and he changes the different brand. So there, the collaborative planning and shared decision lacks. Second thing, taking ownership to the disease. Many times people are not taking ownership to their conditions in non-communicable, and they think it will be like, oh, today I'm going to a party. I have to eat lot. So I'll take extra five amount of insulin. It is not the right ownership. The ownership is wherever I go, I know this is my condition. I will only take what is allowed to me. So this self-management is not coming. They easily think, oh, like I have taken a little extra amount of alcohol. I'll take little extra insulin. That's not a daily ownership, and the support system should build them the long lasting behavior change and make them confident to tell, yes, I'm a diabetic, I'm eating in my portion control, and I will follow my autonomy. So this is where the psychologist is taking the non-compliance based model to the shared decision making and empowering. This way we bridge between the knowing and doing. Many of the times, many of the disease, we all know what it is, but the attitude and practice is the lack, which is where psychologist has to step in and tell what not to do and what to be done. So, what can we actually bring into our desk in the healthcare segment? First and foremost, behavioral assessment, understanding the pattern of the client or patient, triggers, barriers, what makes their health narrative behavior, health relevant behavior poor. So, next is how much they can evoke their intrinsic motivation and lasting change. For example, even in smoking cessation or alcohol, we do this wonderfully with the motivation interview and phagostomos and other things. But when it comes to diet, we all, oh, is it possible? Because many times I myself had one I interview long time back. At that time, one of my interviewer asked me, "Why did you like from nutrition? Why did you jumping to psychology?" I said, "It's has a do they both have relationship?" Yes, the relationship is really there. If you all of a sudden go to a person and say, "Don't drink 5 coffees, just do only 2 coffees a day," what will be the immediate reaction? No, I cannot. I need five. No. So till the person is identified diabetes, many times they might not have eaten sugar or sweets. But next day, I got sugar. I will take little sweet. So this is what is happening with the many cases, and this motivational interview is really a support system for them. Not only in diabetes, many of the health conditions, and we can also effectively engage the patient's ecosystem to reinforce the healthy behaviors with the family and the social support. And we can build the patient's belief in their own capacity to manage illness and change the habits and make them resilient and self-efficacious. And also the sustaining treatment plannings over weeks and months and years, or not just clinic visits. It shows their adherence and health coaching. And very important, help we can help patients process difficult diagnosis and make informed values aligned decisions with their acceptance and decisions. So, where is the psychology expanding? The boundaries of applied psychology in healthcare are widening rapidly. Like new disciplines of neuroscience, technology, and behavioral science are creating new roles psychologists across the system. So, what are the emerging frontiers in health psychology, and behavioral medicine, which has the psychological principles, prevention, treatment, and pediatric psychology? Psycho-oncology is almost like more than a decade it is successfully going on and effectively addressing the psychological, emotional, and existential dimension of cancer diagnosis, treatment, and survivorship. And today, after post-corona, the boom is for the digital mental health, where designing and delivering psychological intervention through apps, telehealth, and AI-assisted platforms to reach undeserved populations. Another interesting area of psychology, you might all have attended a few of my sessions in this nutritional psychology. So this is an exciting and relatively new field. I guess I'm one among like pioneers in India to start with this. So the gut-brain axis, food as mood regulation and dietary patterns in mental health, and rapidly moving from research to clinical practice. So I'm effectively practicing in this area for almost more than a decade now, 14, 15 years now. So why this matters? Is it important, or you are just doing something which is not mandatory? This is a mandate by World Health Organization. World Health Organization says most chronic diseases cannot be solved by medication alone, including obesity. So they require long-term behavior change. No semaglutide or no Mounjaro can help a person lose weight. The long-time sustainable healthy practices and good emotional and spiritual health can make us change sustainable. So that's why health is physical, mental, emotional, and spiritual health. Together makes health. So this is not just a opinion. The WHO has consistently emphasized that sustainable improvements in chronic disease outcomes depend on the population level and self-management. Psychological support systems are trained for exactly this. So 80% of the non-communicable diseases are preventable, including diabetes, hypertension, heart disease, stroke, and cancer, where psychologist has to step in, understand our role, and bring the change with the massive healthcare, education, public health initiatives, and healthcare propaganda. So I humbly request at this junction, like American Medical College is doing many things, we should also step into the preventive health and health psychology as early as possible. I think I am on time.
Thank you, ma'am. Thank wonderful section. So essential of better mental health to control the various.
Ma'am, your voice is not audible.
It's not audible. Oh, now it's fine.
Yeah, now it's fine.
Yeah, it's very much important thing to balance the mental health and by the supportive form. And also to control the certain non-communicable diseases through the diet. That is a very much thing you made to go stress on that. Thank you very much. Binita ma'am, come
Yes.
forward.
Good evening, ma'am. As usual, you have always taken us through various psychological as well as the impacts that affect us. Ma'am, I have a question today. I want to ask what is the mindset that you should have, or how should we deal with a patient who has the idea that he or she is having the diabetic, he or she is following all the rules, maybe what the doctor has given, but still she or he finds that she is not able to cope. So, what happens? They start slacking. Dur, the medicine is not working, or my diet may be not okay, or I am walking, but there has been no change. So after a while, they get quite slackened. And I know a lady who is very poor, tea vending woman. She has had 3 strokes with diabetes. Now we have taken her to the doctor. She has given her all the medicines, but somehow I am not able to motivate her to continue with the medicines regularly. I have to go and check whether she has had her food or had her medicines. She says, ma'am, with everything, I have got 3 times stroke. Now, what is left of life? That is the attitude they have. I'm not able to break her off the attitude. So, what would you suggest? What should I do so that I can motivate?
Okay. First thing we have to understand where has healthcare taken us. Okay. In olden days, if the child is for example, if a person is getting jaundice, he might die, isn't it? We all know Ramanujan died of post jaundice.
Many people die of jaundice.
Yes. But today, jaundice is a very much treatable disease. Today, we don't say jaundice is not there at all. We have jaundice, and it's very much, even the child, baby is born, have jaundice, immediately they keep in like a incubator, they will treat the child and give it to you. And the healthcare spectrum, the science has evolved, and we are winning many things except birth and death, isn't it? So, why I have to take this question many times. Even I had a friend of like he is a colleague of mine. He was a kind of very much advocates everyone on the functional medicine. Okay, for the past 5 6 years he was into functional medicine. Before that he was into a corporate world, and after post retirement he understood functional medicine and he started like advocating and educating people so much. And one fine day when he was taken a blood test and he understood, like with the functional medicine he lost some 10 12 kgs also. He became fit and perfect and all those things he claimed. But unfortunately he like found to have the blocks in his heart valves, that to 4 blocks, and he has to undergo emergency bypass. So he was so shocked and asked why me, and he was so ashamed to tell people that I got this because I was advocating functional medicine. How can I this happen to me and all those things? So I told him only one thing, sir, you have been advocating a right thing because you have like 5 6 years before you have understood functional medicine. You started into the prevention. Today you have not ended into the ICU in a collapse. You have gone for a preventive health checkup, and there you have identified, and while identifying doing also you are fit on the mission, you are standing well, and even after identifying also you are standing well, so you are fit to enter the surgery room, and post surgical recovery will be very much easy because you have been doing good things for the last 5 or 6 years, isn't it? So, this is where the medication or treatment is going to support in the post recovery phase. There is nowhere in the world we have, none of the religion or nowhere in the world we have given a dictum that there is no adversities in life. Even today, Wayanad, we have landslides. Okay. So adversities comes to life anytime to anybody. Even while talking to you, I may end up with something. But getting back, coming back, recovery post the incident is possible with the right practice of healthcare support.
Okay, got it, ma'am. I understood.
And one more case I can tell you, a lady who has been very, very, very paka in practicing yoga, eating rightful food, all of the sudden she has TAA, that is a stroke for minutes, and she recovered. And within 4 months, she is paka, all right, back to normal. She was very much slacking. As you said, why should I follow? Why all those things? I told her there are very less people getting back to this in 3 months' time. Because you were doing all these things well disciplined, you are getting back in 3 months' time. That is the very important thing.
Ma'am, the thing is, she is very poor, and this tea making makes her family run. And she lost her only daughter and her husband also. And she has a 80-year-old mother whom she has to take care of. But look at the zest for life that she bounces back each time. And now her left hand is not working, but still she comes every morning 4 o'clock, makes tea, and stays till 7 o'clock and sells tea and takes that money back and runs her family. So I say, I salute you for this. How many girls do I know that live a life like this? Look at the zest for life. That is what I keep telling her, and I keep telling her that you must have everything on time. Do not wait for anything. You're not feeling well, just stop everything, go and lie down. Don't overdo and say, no, I will make the tea and then go. By the time you will fall. So don't wait. If you're not feeling well, stop. Just then stop. So she has been following. Now I met her mother, so she was saying 3 times stroke she has had. I am now scared, if she dies, what will happen to me?
That is the
So you have no
category
words
we
to
are
console.
exactly. That is the one of
You have no
the
words to console. But ma'am, what about medicines which are like Ayurveda, like Kapiva and stuff, which people are advocating and
I
people
don't
are taking?
advocate
And
anything like that, ma'am. I don't advocate anything. Whichever is needed, they has to take according to their own things. Everything has its own good and bad. Everything or scientifically, we should only reach to the scientifically right persons. Even there are many quacks in allopathy to Ayurveda. So go reach out to a rightful people who is rightfully practicing. Don't end up with the online consultations or unknown people or following all this brand promotional medicines and all.
thank you, ma'am. Thank you for being so very empathetic.
Thank you, ma'am. Others like to share? So I have to post the feedback link.
I can't hear you, Meenakshi ma'am. Your voice is not audible.
Today, Meenakshi, I don't know where you are.
I am here only.
Yeah, we can't hear
You
you.
are, you are looking somewhere, talking somewhere.
I'm looking somewhere, talking somewhere. No, no, no. I think Teja is taking care of the session. I'm simply listening everything. That's all. You talk about the child, another thing. About the incubator, ma'am may to explain that and all. I listen.
Ma'am, can I please ask something?
Yeah, yeah.
Please.
Ma'am, what would you tell it to the people who are really into, I mean, they're like, why do they not take the medicine? Because डॉक्टर तो बहुत सारी medicines देते रहते हैं मतलब it means to say that doctors give ample of medicines. It's just like you have to see how long your body suits it or it palays with you, and then they keep on taking that, and then after that they start doing their own medications like uh, for example they do the maybe they do exercise they with the right kind of eating and all these functional things. So how will you tell these people that okay medicine is a important part of it?
So I think your question is like many people who are like doing a self medication, they treat themselves
Yes.
over a period of time, isn't it?
Yeah. Yes.
This is a very big psychological session we need to. Yes, the society which has been like for many years, even my own father, no, if he gets something, he'll go connect. Like even we call the pharmacist brother because we were so closely associated because of my father. He goes directly walk in and tell, get me this medicine for this. For longer time, this was happening in our society. Like when I graduated, I asked my father as well as that brother, why are you giving all such things? Is it advocated? So he told me one interesting answer. That is the culture. If they are not going to take medicine and getting to die, instead I am going to support with what I know, minimal support, and then I will promote them to the doctor. So that was the pharmacist ethic he was practicing, and I really know, because after one point he will say, no, no, after 3 doses it is not subsiding, you go meet a doctor. That is the right thing. So likewise, at one point of time, we have to give them a limited what to say, allow them for some messiness, and then put them in a trap and tell them, see, this is why I told you to do. And many psychological principles, from the trauma informed therapy to the cognitive behavior therapy, use such techniques well, and make them understand. The behavioral therapies is what, according to each person, you have to apply.
Thank you, ma'am. Because
And
definitely,
even we need
yes.
to, I remember in my long time, in my initial days of practice, so that too, we have to sit near the doctor and do our sessions. So this person, like I was just completing my MSc. Before that, I was in my BSc and working under this doctor. So sir said, oh, you are going to be you have like I have done my exams and waiting for my results. You are maybe in 3 or 4 months, you are going to be a psychologist also. Just let me see how you are going to make him understand smoking is good. So this man came and I was talking. I was doing phagostom and all those things, nicotine dependency and all those things. This man continuously saying, anyway, I am going to one day, or one day. Why should I stop? No. After 5 or 6 times, I really got annoyed. I told him, okay, just let's go to the terrace. He looked at me and asked, what? Then I said, let's jump. Anyway, you are going to die one day. Why not you jump today? This is the kind of negative reinforcement sometimes we do. It's not applicable for everyone, but
Yes.
use different techniques according to the patient's belief. Some people are really guilt trapped. Some people are really uh, distressed. Some people are really depressed also. So use the techniques appropriately to the persons, not to everyone, everything applies.
Thank you, ma'am. Thank you. So well answered.
I
Thank you.
too have one question. As far as we as a counselor and psychologist, how to convey the message as far as the physician or any psychiatrist made them prescribe the medicine, means we ask the patients or clients to follow that. As far as the side effect of certain medicines are still there, even though we know how
I
to
couldn't
tackle
get my
this.
question, Meenakshi ma'am. Ma'am,
Yeah,
please.
yeah. As far as I will repeat the question. As far as we psychiatrist or counselor or psychotherapist, we have to stress the clients or patient to take the medicine as per the prescribed by the physician or psychiatrist. So we know they do have some kind of the side effects in the medicine. So what form of the nutritious diet going to balance with this kind of the side effect of the medicines? How we have to approach this?
Okay, we cannot become a nutritionist, pharmacotherapist, and everything. We are only going to reinforce them on the habit of taking proper medicines, and the side effects will be already educated by the diabetes educator or the pharmacist. So we have to reinforce on them this side effects is appearing. Then you have to meet the concerned person. It is not that you can keep on educating everything yourself, isn't it? So the child, for example, the child goes to school, it learns from there. What we do here, we don't teach again. We will make the habit of reading every day, make the habit of understanding and memorizing. Likewise, to the patient or client, you need not talk about the side effects. You need
Yeah.
not talk about the nutrition. Tell them, see, this everything has a packet with that. Driving a car has a packet of safety measures.
Oh, yeah.
So you cannot become a automobile engineer, but you can drive a car. You can understand what are the side effects. When there is some beeps and warnings, you should go to the mechanic or the concerned person. Likewise, the problem is noticed. Be listening, be attentive to your body. If there is some problem, go to this people where and whenever necessary.
That's fine. Thank you, ma'am. So
Yeah.
others like to share? It's really very much good. Most of the hospitals, they are not giving this psychoeducation. Psychosocial education is not there. Very acute care like oncology centers or not in the diabetic centers, and the big hospitals where they do have the rehabilitation, just like the fracture treatment or
Mainly
something.
it's because our education system has not brought in hospital psychology or healthcare psychology into a field, core field.
Yeah.
We should, like, after BA psychology, we are going for BSc psychology, we are going for MSc psychology. Instead, after BSc psychology honors, we should go for different specialization: healthcare psychology, child psychology, adult psychology, geriatric. Old age is becoming an important area, geriatric counseling, and all those things should evolve into multiple specialization in MSc level. Then only hospitals will confidently bring us in. That is what
Even
I
though we
understood in the 25 years.
yeah, that is also there. Even that also, the sisters and the nurses, they do have the primary role of educating certain things and to bounce back. That is a vital role of the sisters. We have to appreciate them also. So they made to give the treatment as like the keen attender as well as the caretaker, everything there. So they have the better, I thought the sisters have better psychology than us. That's all.
Exactly, because long time our doctors and nurses are doing this. It's no, because there is no availability of resource. It's
Resources.
not that they don't want to use. Honestly, they will all welcome us if we confidently prepare some next generation to that level.
Yeah, that's important things.
So
So
we as educators, we as medical like colleges, we should bring in such innovative courses and tell that our people are ready to support the care system.
yeah, primary care system is very much important. That's important for the each and everyone. That's what the WHO is stressing on. Thank you, ma'am. So others like to share something, come forward, or
But ma'am, I
otherwise.
also feel that awareness about the medicines and the psychology of the person is also required to change. I mean, we as humans we really need to work on that. That how if some medicine has not given us some symptoms, we should not jump upon the guns and may try to treat ourselves with that. So psychology also needs to be changed among all of us.
Attitude to life, we know everything what she rightly said. We know everything. We have to understand and use our intelligence to benefit ourselves. What we don't do is we think, oh, theek ho jayega. That is
Ah,
the biggest hopelessness actually.
true. But yes, this is what, ma'am, we all have been lived with this kind of psychology.
Very
We
nice.
shall not.
We have some 34 participants. How many students are here and how many of you now thinking of taking this as your core field? Can I quickly get some answers like hands raised or something? How many students are there? Okay, I can see only one hand raised. Okay. Glad to see at least two people, three people has raised your hands. Very nice, and wishing you all the best. And like anything, anytime, just get connected to us. We can help whatever way we can.
Thank you. Pragnesh, want to say something? Welcome.
No,
That's
man,
great.
just that like student till the last breath. Actually, that is the thing.
Yeah, all of us keeps learning till last minute. Sure. Thank you, everyone.
Ma'am, thank you. Ma'am, I also have a question. Ma'am, how do you think that breaking the news of a debilitating disease, malignant, maybe cancer, how would you break the news to the patient? Now, these days, there is lot of awareness about about your rights as a patient. consumer rights. I got to know that there was a case where the patient sued the doctor that you did my hysterectomy, that is removal of the uterus, without my consent. On the operation theater, you were operating for an appendix and you did this because the consent was given not by the patient but by a relative. Now, the doctor actually lost the case in this scenario because the patient's approval is a must. Now, in because it's a double sword, because so many people are rising up to their rights and knowing about their disease and AI conscious and getting to know things from the online portals. So my question is, how do you break the news to the patient without scaring the patient? At the same time not scaring the patient. So the doctors also want to be safeguard themselves, if I may bring in this word. So they want to break the news, yet and earlier times, they would say aap theek ho jaoge. The news would be only broken to the close family members. Consent was not an issue. Chota sa operation hai, ho jayega. But there was a lot of reassurance. So these days there is a complete change. So, of course, the role of a psychologist becomes very eminent here. But if you could just bring in your thoughts.
As a psychologist, I will not go for breaking the news. The breaking news should be done by the doctor himself, because the doctor is the right authority to give after the clinical and laboratory biochemical correlations. He is the person who is diagnosing. So he is the person who is authorized to inform the patient that they are going to this debilitating condition. And then he will say, see, you have many treatment options and how to go about. And once it is all said, done, he will tell, to make yourself emotionally better, you please talk to our counselor. Breaking the news is not our authority. We are not authority, mainly.
Thank you, ma'am. It's a good session. They need your contact. Bhavana says thank you. So, with your permission, I will ask Teja to come forward. Teja, are you there?
Yes, ma'am. Can I start?
Yeah.
On behalf of the Department of Psychology, the American College Madurai, I extend my sincere thanks to all who made today's event a success. A heartfelt thank you to everyone gathered here for your valuable time. We are grateful to our associate partners, Yellow Point India Counseling and Wellness, and the Tamil Nadu Counselor and Psychotherapy Association for their support and collaboration. Thanks to our principals, faculty, and students for their encouragement and active participation. Finally, a sincere thanks to the organizing team and volunteers for their smooth coordination. Thank you all. Thank you, ma'am, for this amazing session today.